everyone. We will begin today's COVID press briefing with Mayor John Cooper and Dr. Alex Jahangir, Chair of the Coronavirus Task Force and Chair of the Metropolitan Board of Health. We will also be joined with a video message from Dr. James Hildreth, President and CEO of Meharry Medical College. Also here today is Dr. Rand Carpenter, Chief Epidemiologist with the Metro Public Health Department. And of course, we'll have Director-in-Chief William Swan of the Office of Emergency Management and Nashville Fire Department here to help answer your questions. We'll start with Mayor John Cooper.
Good morning, Nashville. To begin, I'd like to address a Metro HR investigation into the actions of Dr. Michael Caldwell, Director of Public Health. I've reviewed the HR report, which describes behavior that is inappropriate for any Metro employee. Everyone, regardless of sex or gender, deserves to be treated without bias in the workplace. Now, even in exceptionally stressful times, we must take care of each other. And the Metro Board of Health will meet this evening to discuss the report. Now, during the next 6 weeks, our community is at its most vulnerable during the entire course of the disease. Community spread is at its all-time high. Hospital capacity is stretched thin. And the health risk from the number of gatherings and the size of gatherings will increase during the holidays. Also, as we roll out our immunizations in the weeks ahead, we may unintentionally relax our guard before the vaccine really starts to protect our community. Now, Dr. Rand Carpenter, Chief Epidemiologist at Metro Public Health, will discuss Nashville's role in the immunization plan momentarily. The general plan is that first, the vaccine will go to frontline healthcare workers, long-term care facilities, and first responders. Dates and details are still changing. We don't know when the vaccine will arrive, and we don't know the quantities. But the plan is that the state will directly provide an initial supply of doses to high-risk healthcare workers and long-term care facilities. This will help preserve our local hospital capacity. But when the vaccines do arrive, the Metro Public Health Department will be responsible for vaccinating assessment center staff and first responders to ensure the continuity of essential services. But we do not yet know exactly how many doses will be coming to Nashville. Now, the vaccines we expect to receive will require 2 doses and can take up to 35 days to achieve immunity. That's why the next 6 weeks are so important, and why I'm urging everyone to be especially careful. Immunity for the population will not be achieved quickly, and currently we're still in the middle of a surge. Our latest 14-day average coronavirus case count is 513, up nearly 4% since last week. Our average of new cases per 100,000 residents is 68, which is similar to the rate we reported 7 days ago. Now, in November, leading up to Thanksgiving, our hospital saw 318 patients a day on average. Now, Nashville has exceeded the 400 active COVID-related hospitalizations number. Now, for context, we had twice as many hospitalizations in November than in July, back when the surge in COVID cases peaked during the summer. So let's keep wearing masks, maintain a safe distance from one another, and avoid large gatherings as much as possible. Now, I want to take a moment to thank Nashville businesses for all they are doing to protect their staff and customers. After 613 visits to local establishments over a recent 7-day period, Metro Public Health reported over a 98% compliance. Your cooperation is making a difference. Now, on Monday, Metro Action Commission began accepting applications to help distressed homeowners and renters. The initiative is funded by the Nashville CARES Act funding, allocated to the Community Development Block Grant Program. You can apply now for up to 6 months of assistance to avoid eviction or foreclosure. To apply, visit nashville.gov/MAC, nashville.gov/MAC. Now, today we as we routinely do, and it's quite wonderful, we want to honor community heroes. We want to honor those today at Leadership Music for volunteering at the J.E. Moss Elementary Food Distribution Site. Leadership Music is an educational organization created to serve entertainment industry professionals. And throughout the pandemic, the members of Leadership Music have shown up every week to help distribute meals. Now, I'm grateful for their dedicated service to our community. Now, since the start of the pandemic, Dr. James Hildreth, President and CEO of Meharry Medical College and a world-renowned infectious disease expert, has taught us about a complex virus in teachable terms. Separating facts from fiction, Dr. Hildreth shed light on the virus and helped us respond rather than just react to the pandemic. Now, Dr. Hildreth has been selected by the FDA to join its Vaccines and Related Biological Products Advisory Committee. Now, this is a select group of independent experts that have the pivotal role in evaluating the safety and efficacy of the COVID-19 vaccine candidates. Now, it is great that we all know someone who's making such an important decision for our country. And we take great pride in Dr. Hildreth representing Nashville, his representing underserved communities, and is representing other vulnerable populations in this critical process. And knowing Dr. Hildreth is there should give everyone great confidence in the FDA's decision. The FDA committee is meeting this morning, which is why he isn't able to join us in person, but Dr. Hildreth has prepared a brief video message. And finally, happy Hanukkah to everyone celebrating this very special holiday. I wish you all peace and good health. And I'll turn it over to Dr. Alex Jahangir, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest on coronavirus in Davidson County. There are now 3,273 active cases, up from 3,164 just last week. The total number of cases in Nashville from the beginning of this pandemic is now 52,479, with 846 cases being added just yesterday. Our 7-day positivity rate now is 15.5%. As a reminder, last week we were at 11.5%. And frankly, this is not great because ideally we want to be below 10%, and at our best we were near 3%. So this really does show, given the amount of testing we are doing in this community, that this disease is very broadly spread through our community. Speaking of testing, the total number of tests that have been performed in Davidson County residents since the beginning of this pandemic is 696,000 tests. Just last week, we had 28,347 conducted in our city. 393 Nashvillians have died from this virus. And while the mortality rate is 0.76%, I do want to remind you that if you're over 65, the mortality rate jumps tremendously, up to 14% of those over 85. Our transmission rate is at 1.16, and our hospitalizations are as follows. In Middle Tennessee today, we have 714 people hospitalized. Now, that is less than our 757 we had last week, but just Tuesday, we had 764 people in our hospitals. Also, Davidson County hospitals currently have 405 individuals, which is, again, down from 440, but just Tuesday, we had 444 individuals. So hospitalizations are at an all-time high. Now, there have been planning about the state vaccination plan over the past several days. In fact, this week, I and others from the health department and the mayor's office met with the Unified Command to discuss this rollout plan. Now, this plan is to phase in the vaccine, with the top priorities being inpatient, high exposure healthcare workers, nursing home residents and staff, and first responders. Then on to other phases so that eventually everyone gets vaccinated. The Pfizer vaccine is in the final review process. In fact, the FDA committee is meeting currently to discuss this, and I hope that we do hear some news later today about this. And the Moderna vaccine is up for approval next week. Once they're approved, the state expects for us to receive our allotment. And the first shipments will go directly to hospitals and then to first responders. And we'll keep you updated as the vaccine information becomes updated. In just a minute, my colleague, Dr. Carpenter, will fill you in with a little bit more detail. Now, the one thing you can plan on is this: take the vaccine. It's the end game to this pandemic. Vaccine is effective only if it is taken. And if the vaccine is proven safe and proven effective, then I will be the first to line up when it is my turn. And I'll make sure I get the vaccine and my family gets the vaccine. And I strongly encourage you to please get the vaccine. Now, a quick reminder, if you think you have been exposed to someone with the virus, get tested. The community assessment centers are open today and tomorrow from 8 a.m. to 2 p.m. But please check each day, as the site hours are variable depending on the weather. Now, Nashville, thank you so much for everything you have done. The vaccine is coming, but again, please, until then, do your part. Stay apart, wear a mask, and keep your social distance. I now would like to introduce Dr. Hildreth via video.
Morning, Nashville. Sorry I can't be here in person today, but I'm part of the committee at the FDA that's reviewing the Pfizer vaccine for approval. And if all goes well, by the end of the day, we're going to have a vaccine approved for use in the United States, which is very exciting. But before there is widespread distribution of the vaccine, it's going to take much more work and a few more months. So until then, we need to do all that we can do to keep ourselves and our communities protected. So please continue to wear your mask, avoid crowds, wash hands frequently, and please get a flu shot. Be safe, Nashville. Thank you.
We ready? Thank you, Dr. Hildreth. Now we'll hear from Dr. Ann Carpenter. Dr. Carpenter.
Good morning. Regarding COVID vaccines, the Metro Nashville Public Health Department has plans in place to carry out our main roles, which are to receive, store, and administer the vaccine that is allotted to us. We have a unique ability to handle these vaccines, especially with respect to our freezer storage, that will allow us to store any of the anticipated vaccines. And we've been making plans and refining those plans for some weeks. With our equipment and staff capacities and partnerships with other agencies and community partners, we are able to handle large or small amounts of vaccine depending on what we receive. The vaccination priorities that were set by CDC and adopted here in Tennessee focus first on vaccinating those among us most likely to encounter COVID patients and those who are most at risk for severe complications, including death. In Tier 1A, we are responsible, in cooperation with Nashville's fire and police departments, for vaccinating first responders, like fire and police personnel primarily, and some other smaller groups, such as COVID-19 mass testing site staff, people who are exposed to COVID as part of their work, day in and day out. Hospitals will receive vaccine directly for vaccinating their exposed staff, and the state will work with retail pharmacy, as has been arranged for some time, to vaccinate long-term care facility residents and staff. We anticipate that the first vaccine will be approved soon, and larger hospitals will receive their first shipments to begin their work very quickly. We will await further details from the state on receiving vaccine to move forward with our work. We encourage Nashvillians to carefully consider the great value to themselves and to their community of being vaccinated as we move into this next phase of the pandemic. Thank you.
Thank you, Dr. Carpenter. We'll now begin taking media questions, starting first with Blake Farmer. Blake, good morning.
Yeah, good morning. With all the cases that we're seeing, and I'm not sure if this is a question for Dr. Caldwell, if he's there, or someone else with the health department, but we're hearing about big backlogs with contact tracing. Has there been any I know Hamilton County has discussed kind of suspending contact tracing efforts for the time being because they're so far behind. Can we get some sort of update and maybe if there is any sort of plan to address the backlog?
Thanks, Blake, for the question. It's a difficult situation. There are a variety of delays that are hampering the contact tracing efforts. Some have to do with lab and reporting into the health database that's statewide, and having a backlog of cases and contacts is something we are dealing with. We are getting to the point where that's improving. We're more able to get in touch with contacts and cases more quickly. We're also considering other options of prioritizing those cases and contacts that we find out about that are in the most recent past and not as meaningful for cases and contacts that have happened more than 10 or 14 days ago. We're also considering a shift to a different model of surveillance for COVID, and that's something that has to be discussed with the state and within our department, but discussion is ongoing. Thank you.
Thank you, Dr. Carpenter. Blake, I'd also add that once we receive that information from the state, once it's put into the database, we're still contacting the individuals once we receive it within about 48 hours. We're able to do that with our own disease investigators and also using teletask. So that's something that we are able to keep up with, but also understand that we're seeing more and more cases, so that will continue to be a challenge. Our next question is from Tosin Fakili at Channel 4. Good morning, Tosin.
Good morning. Thank you for taking my questions. I have two questions. One is kind of two parts, and I guess maybe Dr. Alex Jahangir can answer it. So we know larger hospitals are going to get the vaccine, the Pfizer. That's what we've heard from the state. Do we know if any of the large hospitals in our areas are on that list of about 26 that are supposed to get it? And there are concerns that the doses are not going to be enough for both healthcare workers, frontline workers, and long-term care residents. Do you guys have that concerns with the first doses coming to this area? And for Mayor Cooper, and I don't know if you can talk on it, with the the concerns with Dr. Michael Caldwell at this time, even though it's still in review and investigation going on, does he stay on, or what's going on with him at this moment in his position? Thank you.
Thank you, Tosin.
Refer to me too. So, Tosin, good morning. So, the most recent information from the state, and I have to, I must give a disclaimer that I think it's all variable, right? So I think any of us who are being honest with you about this will tell you that all this is variable depending on what happens with the FDA, what's the federal government's allocation to the state of Tennessee, and then the state of Tennessee's allocation to each municipality. Nashville right now, Nashville metropolitan area is steady to get about 56,000, a little over 56,000 doses of the vaccine as soon as it's available. Those are going to hospitals in our region that meet certain thresholds for size of employees. I'll defer to the state to give you the exact allocation of which hospitals are getting it, but I do know there are several of our hospital systems are getting the vaccines. Now, how the 56,000 doses are allocated within the hospital, there are some guidance around that. That is, again, still evolving. Now, I think the state will be the first to tell you that 56,000 doses is not enough for everyone on the front end. But the whole point is 56,000 potentially in arms by this weekend is pretty impressive. And then hopefully it's shortly thereafter, maybe as early as next week, we'll get another dose of things and another dose of things until everyone gets it. So consider 56,000 a down payment on what will eventually end up being millions of doses to our region. So thank you.
And thank you, Tosin, for the question. The Metro Board of Public Health is meeting tonight on this matter, and I will, I'm sure they'll be giving a report to me shortly thereafter. So I think the next step in the process, and it's important that we respect the process and have a strong and professional process, that the next step of the process is for it to go to the Metro Public Health Board. Thank you.
Thank you. Kathleen Seary from Channel 17. Kathleen, go ahead.
Good morning. Thanks so much for taking my question. So this is not COVID related, but we're hearing concerns, particularly from Metro Council members, about Mayor Cooper's transportation plan, mainly that the plan doesn't go far enough, concerns with funding sources, and they're concerned that essentially these fixes are too little too late. So we're wondering if Mayor Cooper could provide a response to these concerns and if any changes are being made to address them. Thank you.
Well, thank you, Siri, and Fox 17. I was hoping you'd ask that question. It's very important that the city pass a plan. This is how we get state and federal money. If the council does not act, we will for sure get less money, and there will be fewer miles of sidewalk built, fewer improvements made. The improvements in this plan go to all of our neighborhoods, 1,962 separate improvements. They have been carefully prepared in consultation with the community over the last year through numerous public meetings with council members. I think everybody has agreed that there's been an enormous amount of public preparation and support for this. And the need to have a plan is this is how you have funding. If you don't have funding, you will not be awarded funding from the state or the federal government. We depend on those sources for 60% of our funding. So not to act is simply going to cost us sidewalks and improvements being made. Now, the Biden administration has telegraphed that there's going to be substantial more infrastructure funding available, but we have to be ready to meet that challenge. We have to have a plan. It's really not acceptable for any city not to have an active plan. There may be other plans. We can always listen and improve and make them better, but we have to have a plan. So this is a great moment for hardworking council people have been working on this for a long period of time. They deserve to take a bow because finally they're going to get into their districts improvements that they and their entire communities have been asking for a long period of time. The perfect can be the enemy of the good sometimes, but let's not be paralyzed in what is basically a simple choice. This is a $1.6 billion plan. If adopted, most of the funding will come from other parties, not on the Nashville taxpayer. We're able to do it within our budget, and we're able to bring those benefits to really 95% of the population that's going to be living very near to a benefit from the plan. So, of course, I would urge the adoption, but I also want to commend the council for their hard work and preparation because it's involved thousands of hours, hundreds of meetings. So many people participated in community meetings, and this is reflecting their intention. This is less the mayor's plan than it is Nashville's plan. And Nashville really came together on this set of common sense, high return on investment improvements that get people to work and to school quicker, better, and easier. So this is it's a great moment for Nashville, and we should not be deterred by kind of naysaying when what's at stake is really hundreds of millions of dollars that we would not otherwise get, and frankly will go to other cities. So let's us get it done. Thank you.
Our next question is from Brett Kelman from the Tennessean. Good morning, Brett.
Good morning, everyone. I have two questions. The first one focuses on vaccines and likely would be most appropriate for Dr. Carpenter. It sounds like hospitals will be responsible for vaccinating their frontline workers. Metro Health will be responsible for vaccinating first responders. Who is going to vaccinate the people in nursing homes and other long-term care facilities? What agency is responsible for that task? And then my second question pertains to the post-Thanksgiving infection surge. I know there's been a great deal of concern about the inevitable rise of infections after Thanksgiving. But that surge is a little hard to measure because obviously it takes a certain amount of time for the virus to surface and then significant more time for tests to come back and confirm infections. So are we in that surge now? And if so, are we just at the beginning or are we in the middle of it? Place us sort of where we are in that expected post-Thanksgiving surge.
Thanks, Brad. Dr. Carpenter?
Thanks. And as you said, hospitals will receive vaccine directly and are responsible for vaccinating their own staff, lab workers, frontline healthcare workers, even environmental staff. First responders are a chore that we're working with those departments directly, and the health department will be heavily involved in making sure that works. Long-term care facilities is a unique arrangement between the state and retail pharmacy. They're working together. Walgreens and CVS are the big players in that, but there are also some smaller pharmacies involved. And the state will have some strike teams carrying vaccine to some long-term care facilities and staff. And of course, in our efforts as the health department, if we encounter staff from long-term care facilities that come to us for vaccination, then they'll be included right in with that. The surge or a possible surge in cases after Thanksgiving holidays would be something that we're just now encountering. We've talked about some of the delays in finding out about cases, and so it's sort of hard to pinpoint when you're at the beginning of a surge where you are and if one will in fact occur. We are still ramping up. The numbers you heard this morning are evidence that we're ramping up in cases even now, and whether that's due to Thanksgiving or just this continued widespread spread in the community, it's hard to pinpoint at this time.
Thank you, Dr. Carpenter. Our next question is from Julia Palazzo from Channel 2. Julia?
Good morning. Thank you so much. Two questions. We've seen a shift in COVID-19 hotspots over the past couple of weeks in the county, particularly went to the Houston area, also talking about Bellevue. Any trends, any particular reason that we're seeing that pattern shift? And also, once we do get vaccinated, this is a question that's kind of come up a lot. Do we stop wearing masks? What do you think the recommendation on masks is going to be, and how long can we foresee wearing them after vaccines are starting to be distributed? Thank you.
Thank you. We'll have Dr. Carpenter answer the first question and Dr. Jahangir answer the second question.
Some of the shifting geography of the disease, the hotspots that you mentioned, is difficult to pinpoint. I think that we probably have had an increase in residential areas where there are gatherings around the holidays. We continue to look at those trends and try to analyze them, but nothing that's dramatic to explain now.
And Julia, the question around masks, I think the right answer is when we have enough community immunity, and that typically is about roughly 70 to 80% of our community is vaccinated, then I think we could be at a point where the risk of spread is pretty low, and perhaps at that point we can really go back to kind of where we were before all this. So if I had to make a guess now, I'd say that whenever we can get 70 to 80% of our community vaccinated, that's probably when we can start living a similar to a pre-pandemic world. I do want to make one correction, actually Blake's question earlier. I think I might have mistakenly said 56,000 doses are coming to Nashville in the next few days. 56,000 doses are coming to Tennessee, of which the Nashville hospitals are getting an allotment that's commensurate to the size of some of our hospitals. So thank you.
Our next question is from Yoon Jong from the Tennessean. Good morning.
Good morning. So back to the contact tracing questions. Can Dr. Carpenter kind of give us some more details about what he means about a different model of surveillance? What are those options that are being explored? And just to follow up on what Dr. Jahangir just updated with, of that allotment to Nashville, which hospitals specifically would be receiving those vaccinations this weekend as per you?
Could you repeat the first part of your question, Yoon? It kind of broke up.
Yes, I just wanted Dr. Carpenter to go back. In his answer about contact tracing at the start of this, he mentioned discussions about different models of surveillance that would need to be explored, and he just wanted to see if he can give us some more details about those.
Thank you. We'll start with Dr. Jahangir. Will take the first part.
So I will say I'm going to punt your questions for which hospitals to the state, but what the general model is they're looking at hospital size, who has a fair amount of employees and exposure to COVID, and I think that's how they're making the determination. And they're, I think, in the states really they're figuring out which hospitals will get it based on those criteria, and I just defer to you to them for their exact number. So thank you, and Dr. Carpenter.
Yeah, and I'll continue that a bit with the Pfizer vaccine. It's shipped in containers of about 1,000 doses. And so they want to make sure, and there are very special handling procedures that go with that because, as many of you have heard, it has to be stored at quite low temperature, about minus 70 or minus 80 degrees. And so it's being shipped to facilities that have the ability to handle that and can use an entire box of that so that it gets used most effectively. I'll talk a minute about the surveillance that you ask about. Certainly in public health, there are a variety of different models of disease surveillance that we engage in where we're identifying individual cases and doing extensive investigation around those, or identifying outbreaks and investigating those, or monitoring trends and investigating hotspots. And I'd say that our surveillance up till now has been more focused on individual cases and investigating back to control spread by recommending certain actions among the cases and their close contacts. One model that's being investigated in several jurisdictions around the country is more of a longer-term surveillance model where we monitor trends and are not as concerned about investigating individual cases, notifying those cases, asking them to notify their close contacts, and in general, taking the precautions that we are advancing in the community would be something we would continue to promote. But we wouldn't necessarily pay as much attention to individual cases, but would investigate hotspots and monitor the trends. As I said, that is still being discussed at the state level. We're working closely with the state health department and at our local level.
Thank you. Our last question comes from Harriet Wallace from Channel 17. Good morning, Harriet.
Good morning, Brian, and good morning, everyone that is there. I've got a few questions. First, this one is for Mayor Cooper or possibly anyone from the health department. We are continuing to see these numbers spike, and you all have even shared that some of our numbers are worse than our original peak back in July. At this point, while we wait on the vaccine, what will be done? What more can be done to prevent this spike in these cases, which is closed schools and activities, and to say just wear a mask, that clearly at this point is not enough. Is there anything that businesses, people living here need to be prepared for with regards to maybe another shelter at home or any restrictions? My second question, just out of curiosity, with the vaccine, obviously there are going to be some rounds given. Will there be any requirements for anyone to take the vaccine and any consequence if they do not? And my last question, this is with regard to Dr. Caldwell. In a time when we are talking about fair and equal access to the resources needed to combat this virus, such as vaccines, there could be, are you all concerned at all about any cloud of question or doubt about the health department's ability to do so with regard to the accusations in the HR investigation? Thank you.
Thank you, Harriet.
Well, thank you, Harriet, as always, for your good questions. Yes, the spike is, of course, a concern. I know Dr. Jahangir talks to hospital administrators every day. I do, too. I know they're worried. We should be worried. But what we are doing is really more than so many other places. But we need to keep doing them and doing them well. So that is the rule of 8, masks, having strong guidance from Metro Public Health on any kind of group gathering or activity. In a period of community spread, it's not that easy to reduce a surge. I think that's what makes this December surge so difficult. And we have to keep doing what we're doing. It's we will always evaluate opportunities, but there's no silver bullet. And I think we're all, as a society, being educated in what we need to do to get us through this, and we kind of know what that is. We don't want to derail the progress that we're making. So in terms of, I think, any anticipated change right now in our public health protocols, we're not seeing it because you can't see the direct benefit from some of these changes. So we're pretty good in compliance. You know, imagine this fabulous statistic I had in this press conference earlier of 600 visits by the public health department, 98% is complying. It's maybe wishful thinking, but this week and last week, it's a little bit more of a plateau than it was coming up. I think we should all feel good about that, and we just can't relax thinking that vaccines are here around the corner and then all of a sudden it is over. We can't call the game. What do they say in football? You have to remember to play the fourth quarter too, right? And each of us do our part. Now, in terms of consequences on the vaccine, the question is, I'm sure the first thing we need to do with your help is to communicate that the vaccine is not going to be a danger to anybody. This is why, Dr. Hildreth, we rely on so much. They're not going to be approving something that is a danger. We also have the benefit of other countries vaccinating probably hundreds of thousands of people before it gets to Nashville. So we've got another data set here to reassure people. And so the trick is to have broad public buy-in to do something that is just terrifically positive for the public health. When it is my turn in line in this priority that is set, I am, of course, going to get the vaccine. I trust Dr. Hildreth and experts like him to make excellent public health choices. It's a great technology achievement, the vaccine, and it's gone through a thorough vetting, and it's just amazing that we live in a country that could get this done in a year, frankly, and that we need to trust science, particularly when science has been doing double-blind, large-scale testing for some period of time on this. We're also grateful that there are probably numerous vaccines that are all going to be successful. But with that, let me turn the last question over to Dr. Hildreth.
I appreciate it. So, listen, I'm the chair of the Board of Health. It's my capacity I take very seriously. And no matter, we're at a very exceptional and stressful time, but it doesn't take away from the fact that we all must really take care of our employees. I mean, there's over 700 amazing employees at the health department, and I, as a board, and me personally, are committed to make sure that those individuals have a safe and healthy environment every day when they come to work, period. No matter the situation that's going on around us. I mean, they're amazing individuals there. And so that's why, you know, when I received the complaint, I took it seriously. I forwarded it on to the appropriate channels because I think it is important to have a fair process here. And that's why we received the report on Tuesday afternoon. We had a previously scheduled board meeting that was happening this afternoon, and we're going to bring this up at the agenda because it matters here. I mean, I think I've been so amazed by the great individuals who've dedicated their life to making this public health in the city strong, and now it's in time of pandemic. And so I want everyone to know that the board is committed to a healthy and safe work environment, period.
Those are all the questions we have this morning. We're grateful for Tim Heaslip and our partners at the Bridges of the Deaf and Hard of Hearing for providing the ASL translation at these press briefings. The next COVID press briefing we will have will be Thursday, December 17th at 9:30 a.m. Thank you for joining us, and that concludes today's press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.